I'm Michelle Orgay. I'm Michelle Orgay. I use the pronouns she, her, hers, and I am the president and CEO of Second Harvest Food Bank of Southern Wisconsin. I'm also the vice chair of the board of directors of Feeding Wisconsin. I hope everyone's enjoying lunch, and thank you for staying for our closing event today, which is going to be excellent. When you look at the agenda for this event, you see the theme of hunger, food insecurity, and health. The uniqueness of this gathering is that it brings together folks who are focusing on similar goals. Just looking at the agenda, you can see that there are so many ways to approach this work. I believe that there's room for everyone in this work. And that's one thing that I'd like to call out, the idea of yes and. At this summit, we have folks from all over the state, from different organizations, different sectors, from different membership organizations, and with different philosophies, different lived experiences, and different work experiences. There's a lot of awesomeness in this room right now. But in nonprofits, we often work with a scarcity mindset. We generally like to share ideas, though sometimes we fall into thinking our way is the best way. But we may not always be comfortable sharing resources. I understand that. Resources are valuable, and when we see how much there is to do, we sometimes fear not being able to do enough. But we've seen more resources become available over the past couple of years, as folks have recognized that food insecurity exists. But food insecurity isn't going away just yet, and we still need those resources. I don't want us to fall back into a scarcity mindset or to stay in that scarcity mindset. We don't need to fight over $1. We need more dollars. When a donor asks me if they should give to Second Harvest Food Bank of Southern Wisconsin or one of our partner agencies, I want to say yes, give us that dollar and give our partner agency $1. We need $2 or $5 or $10. Without everyone in this room working together and well-resourced to do so, folks won't get the support that they need. Impact, by definition, doesn't occur without all of us working together. When you leave this summit, please continue to advocate for and value the work of everyone in this room so that all communities can have the food they need to thrive. Folks that help us with the yes and are our sponsors, most of whom signed on to sponsor our 2020 summit. After 3 attempts at rescheduling due to the pandemic, here we are together finally. Society Insurance has been an impactful partner supporting our network through financial contributions, employee engagement, and volunteerism. Specifically through the pandemic, their support was invaluable, providing support to the food bank and food pantry in their local community to allow for continued service to neighbors in need. Please join me in welcoming to the stage Rick Parks, CEO at Society Insurance.
Well, thank you, Michelle, and it's been a great pleasure to be involved with this summit. It's a tremendous event, and I think I and my colleagues that are here have been touched in a lot of ways by being with you the past couple of days. I've been asked a number of times, I never heard of Society Insurance. What is this? Where are you? And I'll just give you a little bit of information about our company. We're located in Fond du Lac, and we've been in business for 107 years. Unlike the health insurance companies that are with us at the summit, we do property casualty insurance to provide coverage for businesses in the food and beverage industry, primarily the restaurant and bar space. For us, it was a difficult challenge to come into the pandemic because not only was the whole country and our state affected so profoundly, our customers were hugely affected by this. And as an insurance company that really puts all of our attention towards that space, when essentially all of your customers are disrupted all at once, that's quite a challenge. Now, our employees obviously stepped up to the task of addressing those issues, and we're very, very busy, very intense time. It was a time of great challenge for them because just like all of you for the most part, they were sent home to work at home as well. But what inspired me the most about our employees was, these folks, they immediately began to be concerned about their neighbors who were in food lines and who had food insecurity and who they were very concerned about them. And from our standpoint, based on our employee direction, we stepped up our involvement that we already had with Feeding Wisconsin and various food banks and everything, and we really redirected and redeployed our partnerships and our philanthropy to put it towards the basic human needs that are so important. So for us, again, it's particularly fulfilling to have been able to be a sponsor of this, to finally be able to get it going after a couple of years. And I think you're going to be very much engaged with our speakers. I had lunch with them today, and these folks are going to close the conference on a high note. So thank you very much for all that you've done.
Thank you. I believe the yes and concept also applies to our work in equity, diversity, and inclusion. I've been in conversations with folks sharing how they might think that equity means that they're being asked to serve some communities less, namely white communities, so they can provide more food to communities of color. I think we can struggle sometimes because we've been told that hunger knows no color. But because systemic racism is a root cause of hunger and food insecurity, communities of color experience food insecurity at more than twice the rate of other communities. While some redistribution may be needed, we must significantly increase our support of communities of color. And that doesn't mean less than everyone else. It's not instead of, it's yes and. I believe that equity, diversity, and inclusion should be core values in any industry, organization, or endeavor. I can't speak to where everyone else is on their journey, but at Second Harvest Food Bank, for years we included those words, but we failed to commit to learning about what they meant. We lacked humility, and we placed a lot of weight on our good intent and what we thought we knew. We may have provided a lot of food support over the years, but we didn't have the answers that we thought we did. We may have acted with good intent, but our impact wasn't equitable, with culturally meaningful foods for communities of color who are more than twice as likely to experience food insecurity. Second Harvest and other food banks around our state are making investments in racial food equity because we believe that everyone in our community should have enough nutritious food to thrive. We've got a lot to learn from the communities we aim to support. We alone do not have all the answers, and because food insecurity disproportionately affects communities of color, it is critical for us to center those communities as collaborators and creators if we are to make any progress towards nutrition security and food equity. While I'm proud that folks have asked us to partner in this work and are allowing us to invest resources in it, I want to acknowledge that this work was occurring before we invested in it. I'm honored to introduce two amazing individuals who are working in this area and who you'll be hearing from. First, T.R. Williams was born and raised in Milwaukee, Wisconsin. After working in New York City's educational nonprofit arena, she decided to return home to attend the University of Wisconsin Law School. Williams has practiced family law and criminal defense law in the nonprofit and government sectors. After some time in the formal practice of law and education, Williams shifted her professional focus to policy advocacy and healthcare. She later joined the Wisconsin Primary Healthcare Association as its government relations and advocacy specialist. Williams considers advocacy an art form that allows one to bridge the gap between current reality and aspired reality. Williams joins the Department of Health Services after serving as the Deputy Director of External Affairs at the Office of Governor Evers. And I'll say that she was one of the first people I called during the pandemic to ask about whether we were essential workers or not. As if there was a question, but there's an official designation or not, so thank you. Dr. Michelle Robinson is the inaugural director of the new Office of Health Equity, OHE, at the Wisconsin Department of Health Services. As director of the OHE, Dr. Robinson serves on the executive management team and provides strategic leadership and advisory support to advance DHS's health equity and diversity, equity, and inclusion goals. She has held previous leadership roles as the Office of the Inspector General and the Equity and Systems Change Research and Policy Officer at the Wisconsin Department of Children and Families, and is a member of the award-winning Race to Equity project at Kids Forward. Dr. Robinson is an experienced and trusted leader, manager, and researcher bringing over 16 years of professional experience in strategic leadership, change management, anti-racist community engagement, systems change, and social and behavioral research. She holds a PhD and an MS in sociology from the University of Wisconsin-Madison. For full bios, please see the speakers section on the Summit app. Now, please welcome me in welcoming TR and Dr. Robinson, presenting Food Security as a Driver of Health Equity, the Role of Advocacy in Addressing Social Determinants of Health.
Can you hear me now? Good deal. Happy to hear it. Thank you. I see that our checks in the mail worked, Michelle and Rick, for all the awesome things you said about us. We appreciate that. My name is T.R. Williams. For most people who I've ever been in the room with, you will remember me saying that's T like tornado, R like roller coaster, not to be confused with tiara like you would put on your head. Dr. Robinson and I are so excited to be here today. I just wanted to start off with expressing our appreciation. I think as individuals, as professionals, but also officially under the banner of the Department of Health Services, you all have done unreasonable work, doing extraordinary times. And I think sometimes because you do the work and you've been doing the work, it can give the impression that it was easy or it was normal or it was reasonable. And these have not been reasonable times. These have not been ordinary times. And from the bottom of our heart, we thank you for your service and what you've done as what I would consider healthcare heroes in the state of Wisconsin. And so we wanted to make sure you all got some positive vibes. And there are 3 ways that I like to show positive vibes when I'm in a space with people. This comes from my time as a Girl Scout. I was proudly a Girl Scout through high school. And there are certain vibes or good feelings that we give to each other. The first one is called a round of applause. It's the easiest of the vibes. It's for those who might feel a little shy, but trust me, you can do it. I will demonstrate. A round of applause goes this way. Now, there are some of my friends who get a little tense about the hand-eye coordination. They don't know if they should do clockwise, counterclockwise. I'll just say make sure you have some space with your neighbor. So let me see you all demonstrate a round of applause. That looks good. That looks good. The other thing we like to do, my personal favorite, is called a seal of approval. Cross your arms like this. Y'all look good. Y'all look really good. So let's do a seal of approval. Here we go. Awesome. And the last positive vibe, which is a favorite of my niece, who is my best friend, she's 10, is a firecracker. And the way we do firecracker is zoop. Ah. So let me see that firecracker. Zoop. Ah. So I'll give you all those positive vibes. Thank you for your work.
All right. Thank you, TR. So that is my sis, but she is also part-time hype woman, as you see. So she has set the stage so I can come in and talk to you all a little bit about the Office of Health Equity and some work that you all are probably familiar with, maybe some things that you're not familiar with, and probably a lot of stuff that you all are playing direct roles in shaping and leading. So it is with great pleasure to be here with you all today, and let's talk about some stuff. So our agenda today, we're gonna start off, I'm gonna share a little bit about the Office of Health Equity, because it's an inaugural office, and many people are wondering, what is it? How are we gonna work with it? What role does it play in the state? I'll answer some of those questions today. And then we're going to pivot and talk a little bit about food insecurity and some of the things that DHS has been doing. We're going to shift, talk a little bit about some private-public partnerships that we're aware of, many of which I'm sure many of you are going to be like, that's my program. I worked on that. And then we're going to talk a little bit about emerging infrastructure, sort of a vision for what we could do, how we can move beyond sort of the norm today and reach for sort of higher goals around our activities and our policies within this space. And then I'm going to pivot, and Tiara is going to come back up and captivate you all and talk about how do we put this stuff to action and the importance of the role of advocacy. So, the Office of Health Equity. Let's do a quick sort of rundown. The Office of Health Equity, we have a vision, which is we envision DHS, which is a place where equity and justice are really embedded as the cornerstone of all the people we serve, all communities, so that we want all Wisconsinites to live their best life. Our mission is to protect and preserve the health and safety of all Wisconsinites. As a part of our commitment there, we've been committing to identifying, dismantling, and improving infrastructure, institutional infrastructure that either ignore or inflict racism, discrimination, or trauma around and among marginalized communities, and centering our work around some core values. And those core values are recognizing things like acknowledging social and racial justice or injustice. I would also include on here economic injustice, understanding systemic barriers and the root causes that create health inequities. We know that health inequities are caused by structural conditions, where we live, where we learn, what we have access to. We'll talk a little bit more about that in a second. Acknowledge our own complicity in the system, and celebrate the diversity of our staff and of our state, and promote their representation. We also aim to respect the diversity of culture in our agency and in our state, work to empower all voices, give authority to those voices, particularly of our partners and people with lived experience, and share power with them. And we're trying to foster diversity, equity, inclusion, and safety, and access. And last but not least, we're trying to be responsive, promoting cultural humility, and linguistically responsive services in our programs, figuring out how to transform our systems to really do our best at addressing our health disparities, and reimagine and reinvigorate this entire thing. So, as a part of our broad mission, OHE is really organized around two big pillars. One is health equity, and this is really about our external facing work. We define health equity as being that everyone has a fair and just opportunity to be as healthy as possible. This image that I chose to represent this is a common image that you see in public health frameworks of health equity. And what it really aims to do is to show us that when we're talking about health disparities, we can think of this as a spectrum. There's a bunch of stuff that happens on the way to some of the negative outcomes that we see, whether that is morbidity and mortality, which are sort of the worst of those outcomes, or whether it's some of the inequities we see in the social determinants, like food insecurity, like economic access, like education. Our second pillar is around our internal workforce work. And we're trying to organize and really lead and drive DHS forward as a place that can truly be a destination workplace. And what do we mean by that? We are aiming for DHS to truly be a place where people choose to work and want to stay. And a part of what we believe we have to do is to make sure that this is an environment that is inclusive of all folks from all walks of life, from all experiences, from all backgrounds and histories. This illustration I pulled from the Association of Research and Library. They had a fall reform in the fall of 2021 in the midst of the pandemic, where they talked about IDEA. And this was sort of their sort of thought mapping of some of the things that their staff sort of generated as it relates to policies, decisions, programs, practices that they feel need to be addressed in order for their organization to truly embody equity. And so that's the work we're starting at DHS, and we're really organizing it around IDEA. So a little bit about OHE. So OHE is an office that currently consists of myself and 2 other staff. One of my lovely staff, Kimberly Parado, is here. She's amazing and have made sure we got here safely and knew where we were going and what we needed to do. We also have Shireen O'Heidi Hamadani, who is our comm strategist, who really helped make sure we had a PowerPoint and that we knew we were prepared to present. But we're growing as an office. We are building out our capacity and creating staff positions and hiring folks to sort of embody this bigger work. And that work really is organized around sort of these 4 bins. One is our idea work, our stuff around internal culture and climate, our programs and policies, collaborations and partnerships within the DHS and throughout the state of Wisconsin enterprise. We have our health equity work, which is focused both on place and economic disparities. We're creating or reinvigorating an OHE advisory body and doing a lot of work around stakeholder engagement and outreach. We have our minority health program, which has also been reorged into the Office of Health Equity. And that is really where we have some grant-making capacity. We do surveillance, we are doing outreach and education, and also delving into policies and programs. And then we have our broader health equity capacity building, which is about both supporting internally and externally strategic communications around health equity and also providing technical assistance. So let's now shift and talk about the core reason you all are here, food insecurity. All right, so thank you to Feeding Wisconsin or Feeding America, the organization that has hosted today's session. One of the things that they provide is rich sources of data. And so I pulled these screen grabs from their website to just kind of provide us with some context. So food insecurity is a big deal. It's a big deal. It's a thing that we're grappling with nationally. Food insecurity, per this definition, is really pulled from USDA's definition to measure sort of lack of access at times to enough food to be active, to be healthy, to sustain yourself and the people in your home. A couple of things I like to note about food insecurity is that not all households that are food insecure at the moment are always food insecure. And also, while poverty maps on and predicts food insecurity at a pretty high rate, it's highly correlated, we also need to note that poverty is not the only reason people are food insecure. There are people who are not impoverished who are in food insecure. There are people who may be impoverished, but because of their ability to access resources, may be less insecure. So it's a complex issue with a complex population of folks. At the national level, food insecurity during 2019 was, and I would say this is before the pandemic, was estimated to be 10.9%. In Wisconsin, we are at 9.1% food insecurity. One of the things we know is that during the pandemic, in many ways, food insecurity got worse. And Feeding America has done some research to try to estimate to what degree, but know that this number is probably a little bit worse at this point than it was in 2019. But a couple of things to contextualize our current status is, I think the estimate I saw was 10.4% in 2021 is sort of the estimate for food insecurity for Wisconsin. And we know that there are disparities in race, in ethnicity, and also place that are underlying these trends. But in February of 2022, this year, just 2 months ago, we had 381,064 people who were open to or eligible to receive food share benefits based on predetermined criteria from the Food and Nutrition Services. That's a lot of people. We also know that that represented from a payout, a benefits payout standpoint, 537,469. That's a lot of money. It's hard to say, right? All right. So we also know that partially that one of the things that has made that number higher is because some of the policy decisions we've made, including increasing the rate of benefits. So it's that benefit increase estimates to be about 50% or higher PEBT. So this number that I just cited is a little bit elevated than it would have been post-pandemic. So why do we care? I pulled this picture from, the Food and Research Action Center's report. And it's not the greatest picture, but what I liked about it is that it maps out empirically things we know as far as factors that, health factors or ways in which food insecurity impacts people. And we know that food insecurity impacts people mentally, psychologically, socially, and also physically. Those impacts can be intergenerational and that they also vary based on the life force. So some of the impacts we might see for a child differ from what we may see from an elder. I also like to speak to the fact that food is central to our culture, right? Like, I am Southern, I'm from the South, I'm from Texas. The way I celebrate is I cook people meals. So when we have people that are disconnected from food and nutrition, we're talking about robbing people of a core cultural value and a cultural expression. So beyond the health impacts, right? We're talking about something that makes us human, something that some people don't have access to regularly. So let's kind of quickly run through some DHS programs for sake of time. So we have food share. Probably everyone in this room knows what food share is. I know that some of our colleagues from DHS did presentations about a couple of these earlier in the conference. Food share and the PBT specifically, but food share is known as the SNAP program, Supplemental Nutrition Assistance Program at the federal level, and it is our nutrition assistance program. It helps people with limited money buy the food that they need and that they need for good health. They get benefits put on a Quest card once a month. We know that people across the state from all backgrounds get help from food share. And this represents folks from a variety of ages, people with jobs who have limited incomes or lower incomes, people living on fixed incomes, people who've lost their jobs. A variety of experiences and things that bring people to need this support. One thing I want to highlight, though, is that DHS recently allocated a portion of some federally appropriated money through the American Rescue Plan Act. It was about $180,000, and the purpose of these dollars were used to identify and sort of improve our data collection opportunities to figure out how to identify food insecurity in the state. So earlier this year, as a result of that effort, DHS uncovered relevant data that has assisted in identifying individuals and households who could potentially be eligible for food share. And this is some work that is planned to continue, and they're coordinating with stakeholders throughout the state and advocates to assist with outreach efforts to align those efforts to address food insecurity in the state. Additionally, there was another set of dollars that were appropriated to outreach agencies just to help promote awareness of food share to specifically immigrant communities throughout the state, and also our tribal partners. And in the next fiscal year, we're focused on looking at additional opportunities for expanding awareness of services for individuals or households who could potentially be eligible. We have our commodity supplemental food programs, which is a program that offers free or nutritious foods to low-income elders, folks who are 60 years and older. It's known, perhaps to some of you in this room, as stock box or cupboard bound. I apologize, I have allergies and I'm really struggling today. But These dollars, this essentially allows these families and households to get access to a package of food that is not meant to complete a meal, but to provide supplement to their resources. There's the Seniors Farmers Market, which gives our elders access to farmers markets. They can go to the farmers market and they can use their resources, their check, to go and buy fresh vegetables and foods and things of that sort. Our WIC program, which does some similar work aimed at our mothers, people who are breastfeeding, people postpartum, prepartum. And then we have our pandemic Ebt Program, which I won't go into a lot of details about because it was discussed, but there's sort of three pieces of the pandemic PBT program, which basically targeted kids who were in school, allowing kids who were who are eligible for free and reduced lunch to have access to some additional payments, either through the summer and also for kids who are between ages of 0 and 6, to also have some access to additional resources to support their nutritional needs. All right, so partnerships. So within the OHE, we now have the Minority Health Program. And one of the things that we saw within our grantees is that during the pandemic, many of them had to mobilize in different ways, like most of you here, to meet the needs of the emerging needs of the folks that they were serving. One of those needs was hunger and food. And so we had groups and organizations like Fosters of Dane County, that's ran by Ms. Jackie Hunt, who worked with restaurants and built partnerships with them to bring in hot, nutritious meals, which they literally drove and dropped off at people's homes on their own. We have our local and tribal health partners who really have been serving as a conduit of this work. And as a result of their efforts, their programs like our Revitalizing Intertribal Food Systems and Trade Routes program, which is a nice example of a culturally responsive partnership, bringing culturally appropriate foods to indigenous people and tribal elders throughout the pandemic. All right, so for sake of time, I'm gonna skip a little bit to some examples of what works. So we have universal benefits enrollment. Currently in Wisconsin, we have a program called Access, where a person can go in and log in and sign up for a variety of services. But it's incomplete, especially when we're thinking about the full spectrum of what causes hunger. So there's both the symptoms of hunger, food insecurity, and also the causes of it, things like economic access or lack of economic access. Universal benefits enrollment programs expanding and making it easier to reduce administrative burden will go a pretty far way in ensuring that people can get access in a timely way and as easy as possible to the resources that they need. We have programs like the USDA Indigenous Food Sovereignty Work, which promotes traditional food, specifically trying to align the program with traditional tribal culture and agricultural needs. And it's about really sort of pivoting and trying to disrupt or shift the ways in which our previous policy, which has been particularly harmful to our tribal communities, has caused or created conditions for certain types of health outcomes. We have urban farming initiatives. These are things like REAP or PEAT, which is programs for entrepreneurial and agriculture trading, or FAIR. These are programs that are seen in places like Dane County, where you're creating and using the land to connect people with the soil, to create work and opportunities and skills development, and to also address nutritional needs. And perhaps one that I'm particularly excited about is the in lieu of services option within Medicaid managed care organizations. Basically, in models like California, in lieu of services can allow for doctors to essentially prescribe medically appropriate, cost-effective treatment in lieu of medical services. So it could be something like housing, it could be something like food, it could be any of these resources that instead of care, we're saying that the root cause of this. Let's use Medicaid to give this benefit to someone. All right, so lots of work is happening, both internal to DHS and across the state from partners like all of you. And our goal in OHE is really trying to move the conversation upstream to work to address those root causes of these health inequities, including food insecurity. So as we are continuing to work to build out our office and engage in collaborative partnerships, I think one of the things that we're looking for is thinking about how can we sort of zone in on sort of this economic wellness picture so that we can really disrupt the conditions that create food insecurity at the cost. And that's the lane that OHE is really trying to add capacity to in partnership with you all, because we have to do both, right? We have to try to fix the root causes, and we also have to make sure that we're addressing people's needs in the immediate. So please stay tuned. And I look forward for you joining us in that partnership so that we can continue to serve the folks of Wisconsin. All right, TR.
I saw the positive vibe. I appreciate that. Let's give Dr. Robinson, I think it was a firecracker. Yeah. And before the video team gets upset with me, let me make sure I'm not just yelling, but that I'm actually having my mic on. There we go. So I can play right. So anytime Department of Health Services is in the room, at least the way that I interpret my job is we have a responsibility to answer the questions of what we're doing, right? We're a source of power as the state. We have access to decisions, we have access to resources, and so there's a responsibility that we have. And so what Dr. Robertson and I was thinking of in this presentation, I'm a lawyer by training and practice for 2 hot seconds, is that we wanted to be able to level set with how we're understanding health equity, what the Office of Health Equity does. I'm sure Dr. Robinson has appreciated all the fan mail she's gotten. A lot of people telling her what her job is, and she's like, let me level set for people. Any good lawyer would like to start off with that. What is health equity? What is the office doing? And what is the state of Wisconsin doing? The other thing that I'm trying to make a norm for Department of Health Services is also to make sure that good folk like you, the people who do this unreasonable, extraordinary work and don't think the time to brag on yourselves or how to elevate it, I am always about making sure you all know the tools that are available for you all because you are doing all of this awesome work. And I suspect that you may run into some systems issues every now and then. And those systems issues can even be with the Department of Health Services, right? So you all are on the ground doing the work. You know the people in the community. You can give us exactly what's going on, what that hurdle is to access, and then you have all these systems and these structures. And so part of, I think, of doing the great work that you're doing is also being able to have that advocacy lens. And so we didn't want to let you all go without being able to speak to the way in which you all can be advocates, outside of what you're doing in the direct service, but also within the system. And it's fair to, I should start off with saying, I define advocacy as simply the work of bridging the gap between a person's current reality and their aspired reality, right? So they know where they are right now. They feel it every day they wake up. They don't need to take a survey. They don't need to fill it out. They're very clear on where they're at now. And then it's about where they want to be, which sometimes also takes some work and articulating that and finding that out. Make sure that we're empowering you all in that way. So let me start off here, and I'm going to clock myself because I want to give time for you all to ask us questions. What is policy? I think sometimes people use the word and are not sure what it means or how it's being used. Well, first of all, it's a construct. And I think it's very important to understand that it's constructed, because if it's been constructed, it can be disconstructed, right? It can be disrupted. And to really understand that there's a process to it, right? A lot of times we come into this work with a policy already existing, but know that there was a process to get there. And knowing that process can help to empower you in the work that you're doing within the system, and also empower you for the work that you need to do to disrupt the system and to ultimately get that policy change that may be really being an obstacle to the awesome work that you're doing. It is either this construct and answer to a problem that exists or a response to that. So it's very clear here to know that there has to be certain people at the table who are saying that this is a problem and how they're defining it as a problem and whatever solution that they decide to create for this problem. It is what the government chooses to do, actual, or do not do, implied, about said issue or problem. Policy is also can take in the form of law, of regulation, of a set of laws or regulations, and it's an ongoing process. That's the part that's the hardest for me. I'm like, nope, I prepare a case, I have the facts of the case, I have the law, I have my theory of the case, I argue it, an arbiter, whether it's a jury or a judge, makes a decision, and then that case is over. But the process of policy is ongoing, and it is certainly not for the faint of heart. And so advocacy has this continual piece of it being ongoing. And if for those who are like me, who are nerdy enough to believe in the democracy of the United States, that ongoing process is what keeps all of us accountable and what keeps all of us to the ground in the spaces of power and those who are directly working, is this ongoing process that policy is supposed to be. Who makes policy? You certainly have the legislature, and other elected officials, whether it's a school board, a common council, supervisors. You also have the executive branch that makes policy. So at the state level, that is the governor. At the federal level, it's the president. At a more local level, it could be a mayor, city administrator. And they typically do that by how they decide on vetoing bills, or what I would like to say, proposed solutions to problems. And they can also do that in setting a budget. You also have departments and agencies who make policy, and I always get pushback here. And this is my argument for it. The legislature will decide of a proposal or solution. Ideally, as we get to later, they would have talked to a few folks about it ahead of time. That sometimes happens and not happens, right? And then typically there is a space where that policy or program is supposed to be implemented. 9 times out of 10, it's going to be a state agency or a department, right? So the way in which that department interprets that law, implements that law, assesses that program are all small p policy decisions, which is why the work of the Office of Health Equity is so important, that is not only facing externally to looking at health equity outside in the sense of Wisconsin, but also internally at looking at how we are varying ways that we're prioritizing equity within the state agency itself, because we make policy through how we implement programs. It's also the judiciary, the courts, the bench. Every time a judge decides on a case, they've created a new precedent, a new law. They've said when these set of facts exist, with these set of laws at play, this is the resolution, which is what lawyers use to determine why this case should be ruled the same, or this is how this case is different, which is why we're asking for the opposite ruling. So every time there's a court case or litigation, not just criminal, civil, there is law that is created and policy that is created there. The legislature is going to make resolutions, which are statements of intent. They're going to set and approve budgets. They're going to move proposals of solutions forward. They're going to hold hearings and other fact-finding activities. I just like to level set how we're using policy, who makes policy, and the structure of our government. I always put up there, these are the various state agencies, and a lot of the work that you're doing, you're actually going to have that crossover. It's not only about knowing about DHS, you're probably also very involved with the Division of Children and Family Services, who used to be married with DHS, as well as others as well, especially when you look at DACAP and some of the history of the food programs that we have there. So it's good to know who you're looking at, who you're talking to. So this is that ongoing process, right? I'm a visual learner, so sometimes I say the same thing several times just to make sure we're all following along. So the ongoing process of policy is, first we have the identifying the problem part of it, right? As I like to say, I wake up in the morning, I stub my toe. I have to wonder why my toe was throbbing in the afternoon. At first, I thought maybe it was my shoes are being too tight. Maybe I thought, Dr. Robinson is annoying me again, so that must be how it's showing itself. But then I realized, oh, it's probably when I stubbed my toe, right? Identifying that problem is so key, and I know that you all are working with it in direct services, right? You have someone coming to you who may not have the language, literally or metaphorically, to identify what their issue is. So you all, as the good direct providers that you are helping to identify that problem. So you all are uniquely positioned for this type of advocacy work, because that is the work you do, is to issue spot. So once you determine what the problem is, TR, you're stubbing your toe when you wake up in the morning and it's causing you pain throughout the day, right? Then I need to raise the problem's profile, right? So this is a little difficult because I live alone. So it's like, who am I talking to? Who cares about my toe being stubbed? But maybe I decide I need to share with Dr. Robinson to be like, I know I'm a little irritated with you by the afternoon, but it's really because my toe is hurt because I stub it in the morning, right? Maybe I need to tell my boss what's going on with me and how it's impeding my work because I'm in pain through the afternoon because of something that happens in the morning. This raising the profile part is exactly why you all exist. You all are those voices for people who are not in the same rooms that you will be in, right? It is the people who are having this issue, who no one knows about the issue, or they're not being able to get the right folks in the room to know about the issue, right? This is also where you have the opportunity for coalition building, right? Michelle started us off of saying, no, don't just give me $1, give me $1, give them $1, give that $1. We actually need $25, right? It's about finding those other organizations, those other people who can share in the experience of the problem you have, right? So now Dr. Robinson has an investment in my toe being stubbed, because she's like, yeah, you are cranky at 1 o'clock, and I always wondered what that was, right? Now my boss is invested in my toe stub because, yeah, your work product has slacked up a little bit because you're in pain, and I understand it. Maybe I even pull in my podiatrist in this, right? I'm getting a coalition of people who all, for some reason, care about TR stubbing her toe, right? So the work that you all are doing is bringing together different groups, maybe not just in the food bank, food pantry, hunger aspect. Maybe it's looking at people in the business aspect. Maybe it's looking at parents in a certain aspect and bringing them together to raise the profile of that issue. Then you have to develop a solution and get it adopted. And sometimes advocate feels very overwhelmed by this part, right? Well, I know the problem. I could talk about the problem forward and backwards, different languages. I can get all the people I need about this problem. I don't know the solution. And so this is what I always tell advocates. Even when you don't know all the parts, identifying what the problem is and identifying where in the system you're finding yourself finding problems is a totally perfect message to send to those who are in those spaces of decision making, those spaces of policy making, those spaces of resources, which includes the Department of Health Services, right? That there is a mutual way in which we can work together for those problems. Or if you're talking about sometimes in the traditional place when people think of advocacy, a legislator that you may be speaking to, right? Is that even when you don't have all of that together, doesn't mean that you can't bring forward what the issue is, particularly in that unique position that you have to lean into the issue and to be able to articulate what the issue is, especially when you have people with you from various backgrounds and various sectors as you're raising that issue's profile. So you'll have this solution adopted, and typically for legislators, if we're looking at that context very narrowly, that's going to be the Legislative Reference Bureau. Those are nonpartisan attorneys who work for the legislature, who are going to draft in this statutory language that solution, proposed solution to a problem. The reason that I take the time to say this here is not because I have anything against lawyers, but more so to tell you that inside information of how some of these statutes and policies that we see in front of us are being designed, right? They're being designed by lawyers who might have got an assignment from the legislature, which again, may differ in how much information they got from folks like you, from constituents, and having this proposed solution to a problem. After that, you have to implement the proposed solution to the problem. You evaluate that impact, and then that can have another problem, right? So then you go back into this ongoing process. So now I understand I've raised the issue that is me stubbing my foot. I've decided that I'm gonna move my bed 2 inches to the left, and I'm gonna get a stopper in between the dresser and my bed so that it's a gap, but not a gap that I can slip through, and I think this is gonna help me not stub my toe when I wake up in the morning. I implement it, I buy it on Amazon, maybe not Amazon, I'm not feeling Amazon right now. I'll buy it from a local business in my community. And once I have that, I will be able to change my bedroom in order to avoid stubbing my toe. And then I evaluate the impact. Turns out, yep, stop stubbing my toe. Now I'm stubbing my knee. I'm hitting my knee every time because the new dresser is just not there, right? And then I have to reevaluate this problem, right? That is really the policy process. Obviously, with a very trite issue, well, not trite for me because I don't like stubbing my toe, but a relatively trite issue. But it's that same parallel when you're coming to what the people, your clients, your customers, your community members are facing in the food insecurity space. It's also the same process when we're thinking about the work of health equity. I'm paraphrasing someone saying equity is not like a pie. It's not like it's gonna end, right? This scarcity model that Michelle brought forth has us believing in our capitalistic society that there's only enough for so much, and if you're trying to do anything different, you're taking it away. But I always say, I don't ever hear us taking away from that DOD budget, that defense budget, that military budget, right? And that is tons. And then we have the very clear thing that we did was that the US government was handing out checks to people and telling them to stay home and not work for like 2 years, right? So all of a sudden we have to push up against this policy system, this construct that is created that gives us these things that we just take for granted and push them in this policy. So that was a lot of information. I have a little bit more I wanna, and what am I on time, Dr. Robinson? Got to make sure okay, there. So any immediate questions right off the bat, because that was a lot before I go into my next level, deeper dive. I'm looking. Good deal. I like to do the teacher 7 seconds. All right, good deal. That was like 3. So most a lawyer can wait. Just as quick reference here, some important details that I always like to share when I'm in a space with direct service advocates such as yourself. Legis.wi.gov. I live on this site. On that website, you can find out who your representative is. You can see the entire members of the Assembly and the Senate. You can look up any bill. You just got to get the number right. Any bill and know where it's at in the legislative process. Some fun facts, if you ever are on Jeopardy. Wisconsin has come up on Jeopardy quite a bit, so I think this will be helpful. In Wisconsin, we have that bifurcated system. So we have a Senate and an Assembly, just like on the federal level, you have the House and you have the Senate. Assembly is similar to the House and sort of the lower, and the Senate is the upper of that bifurcated system. There are 33 state senators. They have 4-year terms. There are 99 Assembly state representatives, and they have 2-year terms. And I believe all of them are up for election this November, minus those who are retiring. In this structure, we have the Speaker of the Assembly and the Leader of the Senate, and this always seems like a small detail. It's like, T, why do you take so much time on that? Because I think it's an important lesson to be learned here. So you elect someone to represent you. They then join their colleagues in the Senate or the Assembly. One of the first things that happens once they're ready for a session is there is a vote that has happened amongst the colleagues only for who will be the leader of the Assembly, which we call the Speaker, and who will be the leader of the Senate, which we call the leader of the Senate. Those 2 positions of leadership get to determine the committees that will exist for that legislative session. Committees are super important because there are hundreds of bills that come through our legislative process. And so instead of all 99 members of the Assembly or all 33 members of the Senate looking at that proposed solution to a problem at once, they have a committee do it. The committee does it first. They work through it in the process we're going to talk about, and then they bring the recommendation to the full group. So you vote for someone, and they can be voted in by their peers. You're not a part of this, to be the leader. That leader determines what committees exist and who from their party gets to lead those committees, right? The perfect example I use is that at the time that there was Medicaid expansion being fought for, which is like, what time in Wisconsin were we not fighting for Medicaid expansion? But most recently, not this budget, but the budget before, And when there was a portion of the bill, because it wasn't going through the budget process, a portion of this proposed solution that included Medicaid expansion was put forth through a bill, it ended up going to a committee that had never existed, the Committee of Oversight of Medicaid. So it didn't go to a health committee, right? It didn't even go to like a revenue committee. It went to this very special committee. So there's a lot of power in those speakers of the assembly and leader of the Senate who you elect broadly, but don't elect in this campaign that they do amongst their peers. There are the Joint Committee on Finance. It does take a moment to say there that is arguably the most powerful of the committees that we have. It's joint, meaning it's Assembly and Senate members. Most committees are just all Assembly, all Senate, but that joint committee is together. And that is where anything that makes an appropriation, AKA spending money, has to go through the Joint Finance Committee. I have some language there, but I want to keep us going of what I use. Amendments are changes, appropriation is spending. That's really the important part of it. So this is my Schoolhouse Rock remix, abridged version. I always like to do that and see who laughs. Thank you, Dr. Robinson. Because I'm like, am I not getting the vibe anymore with these references that I make? One of the other positive vibes is it's called the Hulk Hogan. And I did it with a group of elementary schoolers, and they were like, we know the Hulk, but we don't know what Hulk Hogan is. I was like, wow, I'm missing it. But you all laughed at Schoolhouse Rock, so y'all know what I mean. I'm just a bill on the hill. Yeah, you got it. So this is my abridged version of how a bill becomes a law. The bill is drafted. We already talked about it. It's not really the legislator that does it. It's a group of lawyers. The bill is assigned to the Senate or the Assembly. The bill is referred to a committee, that very special point that is actually an advocacy point. If you want to step up your advocacy to the 2.0 level, you are working with that legislator to find out what committee it is. And maybe you're advocating that it's the committee you want it to be, right? This is truly a health issue, it should be in here, or it's truly this issue, it should be in there, or maybe it's based on who chairs that committee and who's on that committee is where you're determining your advocacy may be. Once it is referred to a committee, there is a hearing that's held on it. And you know, hearings are not the most equitable situation. Most times they're done in Madison at the Capitol between 9 and 5. I laugh about 5 because I've been in a hearing till like 6:30, 7 o'clock before. But they're public hearings that have the opportunity for public members to then say what they feel about this proposed solution to a problem. And they can do it through writing, or you can do oral testimony. Sometimes Wisconsin Eye will also do like live recordings of those, or live streaming, that's the word. I'm a millennial, I should know that. Live streaming of those. But ultimately they are held in one particular place that's not always convenient for people. Budget hearings are bigger, sexier policy things. So the big budget that we do for the state, you will see hearings go mobile, right? So they'll have like 6 or 7 planned throughout the state over a 2-week period, but still typically doing that traditional workday. After there is a hearing held on the bill and they hear testimony, the committee will then take action and vote. So that's called executive action. If you're looking at like a history of the bill and you see committee executive action, that's the way of telling us the public does not get to have a weigh in on that, right? So you've done all that you can do. You've said all of the things to make you for or against, or the questions that you have about it. And then that committee is going to come together and they're going to vote. The other thing that happens here is they may make an amendment. So even though you've gotten that opportunity to say what you're going to say, you don't actually get to determine the amendment they eventually make for it. And so when you're watching a bill go through this process, knowing if there was any changes to the bill is super important in your advocacy. So they'll vote on it. If it votes and passes, then they will recommend it and schedule it for a floor vote. And that's when it'll go to all of their colleagues in the Assembly, if it started in the Assembly, or all of their colleagues in the Senate, if it started in the Senate. The floor vote is conducted. If it passes, then it'll need to do the same process with the opposite body. So you can't have a policy go through a Senate and then think you're going to get it signed into the law if it hasn't gone through the Assembly, and vice versa. They also have to look the same. So here comes the other way that policy takes a long time and advocacy is necessary, because the Senate is a different beast than the Assembly, right? There's a different group of folks, different group of a split sometimes in the party line. And so there is advocacy that's needed, because for any of that to be successful, to turn it into a law, they have to say the same thing in both bodies. We won't go through the deeper dive because I'm already out of time. I will say the biennial budget process, we're in it now, right? So in Wisconsin, we have a biennial budget, 2 years, right? Odd year of June 30th of one odd year to July 1st of the next odd year. We're currently living in our 21-23 budget, but we're already starting to prepare for our 23-25 budget. There are certainly decisions that are made about spending money outside of the budget. They're just harder to do. So for all your advocates, this is the time now that we're really starting the budget, even though we're thinking 23 to 25 is a long time. And the main point I would share out of all of these words, that September is when state agencies have to submit their budgets to the Department of Administration, the state budget office, which will inform the budget that the governor will put together and present in January, knowing that this is an election year, and so it may or may not be the same governor. So if you're working with agencies, there is an opportunity for advocacy to get those budget requests in now. It's not the only one. It's a very long process, but it is certainly that 2.0 level of advocacy, because you can have a third party rooting for your issue. If I can get DHS to pay for why I should have this special high-rise bid so I stop stubbing my toe, that's gonna be a lot easier advocacy than just going straight to the governor and saying, this is why I need $23.95. Oh, I'm dropping the water. I was like, what's that? So that is a good point or one point I wanted to raise in that. I didn't get to do the advocacy spectrum. It's a long way to say 501c3s can certainly advocate. I had to do the disclosure, which I forgot, is even though I'm an attorney, I'm not your attorney, but I do stand on the fact that 501c3s can in fact advocate, and there are sources that'll show you how and why. I would be remiss if I didn't at least end on sharing this story. So this is what I say all the time when I share this story. I was in Kenya, which is a country in East Africa, when I heard this story. But I am not asserting that this is a Kenyan or African proverb. I just happened to be in that country when I heard this story. So this is how the story goes that I want to share with all of you. So at times in the animal kingdom world, there is a little bit of scarcity in the food chain, right? And as you all may or may not know, lionesses are actually the ones who do the hunting. I don't know if it's because they're more athletic, agile, intellectually superior. I'm not saying those things. I don't know why. But it's the lionesses who do the hunting. So sometimes when there's this scarcity, the lioness will take a lion with them. But it'll be an older lion with a really big mane and a huge roar, but no teeth. So they'll bring this lion on with them, and the way that it works in the animal kingdom world, I always am understanding, how do they know? But they know, right? They'll have the lion on one end of where they see a group of prey, and the lionesses will stand on the other end, right? And so at the right point in time, again, the magic of the animal kingdom, that really big but old, huge mane, gigantic roar lion will let out an amazing roar at the right time. And then those prey, very logical, very reasonable, very emotionally respond by running away from where they hear that roar. But that big lion and the big mane and the huge roar, but no teeth. And as they're running away, the lionesses are there waiting in prey to pounce and have a meal. And so the reason that I was told this story and the reason that I'm sharing it with all of you is that sometimes when it's most scary, when it's most uncomfortable, when it feels like the things that we value are going to be at threat, like the prey, their lives, it is actually better to run towards that roar than away from it. Health equity work is scary. It feels like it comes with a value judgment of the things that you have learned in your life to be true, the things that you love, the people that you love. It doesn't help even more that we have those people who give misinformation about the work of what health equity is. And advocacy is scary. All your day is spent with doing direct service, amazing work. So the concept of stepping outside of that to be in this space that I just talked about can all be very scary. But I encourage you, advocates, with your uniquely positioned knowledge and expertise, to run towards that roar, to not be afraid of that uncomfortable space, to not be afraid of what you believe is at risk, because I actually think that's going to be the space of safety. Thank you all so much for listening to us. We appreciate you. I appreciate that. We'll do a nice good round. Let's do all three of the good vibes. A round of applause. A seal of approval. And a firecracker. Y'all look good. Y'all look good. And so staff are, you got the mic. Okay, I'll invite Dr. Robinson up too, as we can be here to answer questions. Make sure I'm not knocking over any more water bottles.
Thank you so much, TR, Dr. Robinson. Great information. We do have some time to open it up for some questions, and Jordan also has a mic, so maybe we'll both run on both sides. Probably have time for 2 or 3 questions. We'll see.
Dang, I still talk too long. Sorry.
Yeah, we'll be fine. Questions?
As people are doing their 7 seconds, I realize you gotta have a thought, process that thought, and it doesn't always come out your mouth a little bit. Let me say something while you're thinking before Steph calls on you, is that I encourage in the work that we both do for what I call productive disequilibrium, right? All comments and questions don't have to be rainbows and butterflies. I think that the State Department of Health needs to create that tension to know that it doesn't have to always be giving us a thumbs up, because we need to know what's going on. And so part of that productive disequilibrium, I say it's like my Spanx, right? So I have this dress that's my favorite dress that I look really good in. It don't work the same way as it did in law school as it does now. So I put on my Spanx to help me work it out. But at a certain point, I'm gonna need to eat differently and exercise, right? So I have to get to the point of tension where I'm uncomfortable in these Spanx, where they're not enough and the dress is not looking good, to be able to get some movement and some positive behavior. So feedback that's not rainbows and butterflies or Midwest nice is okay, as long as it's getting us to the productive things of changing behaviors. I see some people identify with the Spanx, thank you. I was like, Schoolhouse Rock works, Spanx work, good to know. Telling me a lot about this group.
Thank you very much for the excitement and for the information. I feel like I got a little civics lesson. The nicest one I ever got. My question to you is, I have an issue that I keep coming up against, not only with my pantry, but through the state, and that deals with, when you talk about health equity, I am working with a lot of brothers and sisters who are on wheelchairs and areas that are not accessible, and I am telling you, I am not happy with DVR right now, okay, because if you're a business owner, they sort of poo-poo you and want you to go away, even though that's how you've made your living. So I have an issue, and I need some guidance.
Yeah.
Are y'all willing to do such a thing for us?
And are you saying that the access for wheelchairs is at the food pantry you're currently working at?
No, I'm not talking food pantry. I'm talking the country. So our food pantry is not the issue.
Okay.
The issue is I have customers. I actually have a person who works for me who is trying to get equipment through the Department of Vote.
Oh, I
and
see.
she got her disability rating within the first time she went. And so we're having trouble getting equipment. So it's a Medicaid issue. It is not Medicaid, a Medicare issue, because she's over 65. She's not on Medicaid. But we keep running up against barriers. She keeps running up against barriers, and the fact that she's just slightly larger than size 10, we have people doing assessments for her who don't have any understanding how it is to work with somebody with bariatric issues. So we have a host of issues, and we're trying to sort it out and get to the right location, because I like rattling cages. That doesn't surprise anybody in the room. But I need to know where to rattle.
Yeah.
Okay, so I'm not asking for an answer. I'm asking for where do you send me? Where am I going next?
Yeah. I think, were you saying you had something right away or no? Me? Okay. I'm glad that you brought it up, and I always have to tell advocates that when we hear something to let you know if I've heard it before. So I've heard this before, which is not to say that it's not important, but it's to let you know that you're not alone at bringing this up, and it's not just sort of a single issue. And so I think our Division of Medicaid Services, I know it's Medicare is all, but that would be the branch of where we would need to go. And I'm also thinking more particularly than that, it's our Bureau Director, Curtis, or Assistant Administrator, I'm always forgetting the titles, Curtis Cunningham. And so if you could give me, write down your name and information, I can make sure that we have, because I know we have some resources that I want to make sure you know what those are. And then if those resources are not sufficient, that you're able to give us that feedback to see if what we share with you is actually going to help the problem that you're having. Yeah. Don't forget to give me your name. I mean that. Okay. I heard somebody say, oh, she won't. Good to know. I see your hair, Miss Carla. I know. Now, just like, now you're doing my job, TR. Sorry. Let me calm down.
So I'm going to ask.
I think they got a mic for you.
I'm going to ask my question in a way of connecting the dots to this Hunger and Health Summit. Because my question is about moms feeding their babies in a hunger and health connection piece. And so, though it may not be the subject of the conference here, but because of the connection, I'm gonna make it the connection. And so, there's a policy, and now you really made me think about how to keep working on this policy. How do I do this? So there's a policy for Medicaid that you only can get one breast pump per lifetime. That is archaic, especially when you're talking about equity, maternal child health that we have an issue in our state with, one of the highest. We have DHS talking about disparities and PIPs and how to, make that happen. But how can you expound more on, I feel like now that I'm moving towards a retirement piece, how do I work to make this policy change for the betterment of those women, especially when we know systems were built on white supremacy and built on health systems that did not look like me and the people that I serve.
Yeah. Let's work it through a little bit. Tell me what's the underlying issue of only being able to do a breast pump,
One breast pump at a lifetime.
once in a lifetime.
So if you're on Medicaid for 15 years, you had a baby when you were 15, and now you have another child and you are 22. That breast pump is long gone. You don't even know where it is. You moved 5 times because you're transient. You are at 100% of poverty since we can't get Medicaid expansion. So there is no equipment. So that means the best piece of providing nourishment for your child is through your breast, but you can't afford to go buy the $250 breast pump.
Right. So what I'm hearing you saying, if we were in this advocacy moment, right, is first you're going to tell me why breastfeeding is important, right? You're going to give me the numbers and statistics of why it's important. Then you're going to remind that source of power that in the state of Wisconsin, Black women and their babies are 5 times more likely to die. And it isn't because their bodies can't take it. It isn't just because they don't have higher education. It isn't just because they don't have housing. It is because they are Black, which is a social construct of race, but because they are, right? So you're gonna start off with telling me why breastfeeding is important, right? Assuming that I don't know that, right? And then you're also gonna tell me why this lifetime, once in a lifetime, is problematic. And you're gonna anticipate that I may say, well, why can't moms just keep up with their breast pump? Right? You're gonna explain to me why there is so much mobility in the community that you're advocating for, why they move so often. You're going to bring in the housing and eviction realities in the community that you're in, wherever that's at, right? So then you're going to present this issue, not as just we need more than one breast pump a year or in a lifetime, but this is why breastfeeding is important. This is why it's connected to this atrocious stat that you have in the state of Wisconsin, and this is why I'm arguing that this is a problem. And then if you have that extra ones, you're gonna give me a solution. What do you think that solution should be? I heard more.
Approval. Approval, changing the Ford Health Medicaid coverage, making it accessible, equitable whenever a woman wants to breastfeed.
Yeah.
To have that opportunity.
Yep. And that's
the
when
equipment to help her do it.
Yep, and that's when you're getting to adopt a solution, right? So maybe it's making sure that there is, a policy, small p policy, that after X amount of time you're eligible. Maybe it's for every baby that you have. Maybe it's for if you can associate the warranty that is on that breast pump with a time date, maybe that's what you say. Is even the breast pump itself in their warranty model says it shouldn't be used over X amount of day. And that's why I'm offering that we should get this every 2 years if, a mom chooses is in this program. So that's not all of it, but that's some of what you can then use as your example of how you work through this process.
That's good.
Yeah.
Thank you.
Yeah, of course. They taught me a little bit of some, at DHS. Every now and then.
Well, who do we get it? So who would I get to help? How do I start that process? And who is it? The legislators? Is that where it starts? Does it go to DHS? And I have asked the question to them. Where does it go? Now we have this new Office of Health Equity, which is amazing. Dr. Robinson and her crew is in. But where does it start? Where does that momentum start?
I say all of the above. I say advocates, have to be guerrilla warfare style out here. I think you just did one by bringing it to us. I think that's definitely something we can bring back in leadership. I think that if you're in regular conversations with what I consider a subject matter expert, so I know that, government is hierarchical. We won't act like it is. We sit at the very top at the secretary's office, so we're not seeing these and having these conversations, and we're not the DHS employee you might always deal with, or the one writing forward health updates, right? So you're definitely going to use that person, but I also think you bring it to us as a budget item, right? Because I just told you September 15th is the date we got to have our budget in, right? And I think you have to put those sources of power into a decision point, right? So bringing up an issue or having a question sometimes allows us to answer it or just say, thank you for raising that issue, versus you coming with the stats, connecting it to a stat that we are actively trying to decrease, which is our Black infant mortality rates, and then with a solution. And then that has us contend with you differently. And I also think you do it to the person who is your legislative representative. I also think you do it to the chair of the Joint Finance Committee. And I also think you do that advocacy to the chair of the Health Committee in both the Senate and the Assembly. Yeah. I think I saw somebody get the mic over this way.
Yeah. I'm Yvonne Greer from Milwaukee, Wisconsin, and I'm working with the state chronic disease prevention and health promotion program on a CDC 211 grant that is developing a social determinants of health accelerated action plan for Milwaukee using a restorative justice framework, bringing the community together that's been harmed with the health systems to try to forge a accelerated plan for a better future. And it's got to be done by August.
Of
My
2022? Of this year?
So we'll be having a town hall meeting in about 2 weeks to bring the two forces together, and then we're going to have a planning conference at the beginning of June to kind of force this new thought and this new plan for the future, something that is feasible, that can be implemented, that's going to resonate from community voice to be something positive. My question for you is, how can I get somebody from your office to come to this town hall meeting or to the planning conference? How can we make sure that we're connected, because we're turning in something to the CDC, and it's all community driven, but we have somebody from the state there, but nobody from the policy end is there, and I think that should be someone there from the policy end.
Tell me more of why you want someone from the state there, how you want them to show up, what you want them to do.
I guess the bigger reason is the idea that even though we've gotten this funding to develop this accelerated action plan, there is no implementation money. So that if there is ideas and innovation coming from the community, something that's feasible, then I want to make sure that the state knows about that this is already something being generated from the community that might be able to be something that could be funded.
We'll get your number.
I would say that anytime that you're inviting the state to the table, it is a good advocacy move to define what you want them to do. I think that state and legislators, to be honest, right? I gave them a few, hits, but they are an important part of our process that makes our democracy genuine. And everyone participating in it is what makes it genuine. We, end up doing this theater farce if we try to say we have this Democratic Republic and we're not using all of the branches of government, right? So even when you're inviting a legislator or a state employee, know at the root that they are public servants. There was something that brought them to their job, and typically it's not that it was sexy and glamorous, especially if you're talking about a state employee or a legislator that has worked in this last 2 years. And so because of that, I think there's a defensiveness that sometimes folks have because they're used to being the source of all the problems. There's that they should own, and there's that they should not own, right? And so that level of defensiveness sometimes has them operate and show up in a way that's not intentional or personal, but one that I think is part of that people nature. And so I think when you haven't asked to the state to show up, it's always good to define why you want them to. I want you to consider this as a budget policy, or I want you to consider this as just a thought brainstorming, and we would love to know what areas we can tap in that already exist. Or sometimes it's, I want you to demonstrate your leadership as the state, that you're here in this space so that people can know that there's some connections that we're making. Those always help those types of engagements.
And one thing I just want to mention, because I came up here particularly to see you two. And I brought one of my students here from Milwaukee Area Technical College so that she can see good role models.
Tech. I went to Rufus King though, so don't get too excited.
and just the idea that, as we see more leaders like you that can come to the community, since we're trying to bring the community there, they can also feel comfortable in talking to their elected officials and legislators and people in government, period.
I appreciate that. Thank you. I like the commitment. I still see the positive vibes going. Y'all are the best.
I feel like you just need to reiterate that one more time, though.
What?
The importance of coming to the table with a solution, with an idea. Better thought out, the better. And also knowing sort of like where are you willing to concede and what you're not willing to concede. Because I think those are all of the things that you're going to have to work through as you traverse advocacy.
Yeah, that is definitely true, especially if you're doing the route of, as I call it, getting more people, or more officially the coalition building. The nature of you putting your issue into a spotlight with more people means that creates more opinions, right? And I think that because for advocates, this is not easy work. And I think the last, I would say, decade has been difficult work, that advocates sometimes do I'm gonna drop the bomb and walk away. Like it's either that and not that, right? And I struggle because I'm in that advocacy world, and I think on some situations you have to create those stands. I'm also part of the system because of where I've chosen, but I'm part of the system intentionally because I think you need people who have had experiences like we have had, who have lived the lives that we have had, to be in these seats as well. So it's always tough when I'm telling advocates to have those points of compromise, because I'm not trying to tell you to dilute what you're saying, but I am saying that knowing these systems helps you know how to power map. Who has the power? Where does it lie? Where do I need to bend it? Where do I need to work within it? And in some cases, where do I need to just disrupt it? And sometimes there's always disruption, and it's like, well, how far do you think you're gonna go with the state about disruption? We're not trying to blow up the whole system necessarily. And that's when advocates, though, have that safe distance from being the state, where then you do what you do as the grassroots advocate, right? You bring the coalitions together and you can create this productive disequilibrium outside of the state form if you need to. But I think when you're coming to the state to work with them, knowing those solutions and allowing us to hear it other than what we normally do, which is, you know, it's kind of like all on us, is an effective way to edify the audience that you're trying to move. So I think we way over time. Stuff is like that. Thank you all so much.
Thank you. Thank you.